This is a podcast introducing national health expectancies in the UK. If you would like a transcript of this podcast, email info@ons.gov.uk.
So, what are health expectancies? In this chart, remaining years of life are plotted against increasing age. The green line represents life expectancy. For males in the UK born between 2007 and 2009, you can see that life expectancy is close to 80 years. And for men aged 65 in this period, life expectancy is around 18 years. While this is useful information, it doesn't tell us anything about the quality of life. Health expectancies, on the other hand, provide us with information about the length of time that a person can expect to spend in a given state of health. At ONS, we routinely produce two measures of health expectancy. The first, healthy life expectancy, appearing on the chart now as a blue line, tells us how long a person can expect to live in very good or good health. For UK males at birth, healthy life expectancy here is 63 years, indicating that on average, a little over 80% of life will be spent in good health. At age 65, healthy life expectancy is around 10 years, equating to almost 60% of remaining life spent in good health. The second health expectancy measure is disability-free life expectancy, appearing now as an orange line. This measure tells us how long a person could expect to live without a limiting chronic illness or disability. As you can see, for UK males, this measure produces very similar results to healthy life expectancy. For other populations, females in Wales for example, there is greater variation between the two measures.
Health expectancies are calculated over 3-year periods, and here we will show you recent national estimates of life and health expectancies across the UK for the period 2007 to 2009. Looking firstly at males at birth in England, life expectancy was 78 years, while healthy life expectancy and disability-free life expectancy were around 63 years. In Wales, these figures were lower. Life expectancy was a little over 77 years, and healthy life expectancy and disability-free life expectancy were between 62.5 and 63 years. For Scotland, the figures were lower still, the lowest in the UK in fact, while figures in Northern Ireland were slightly better than in Scotland.
For males at age 65, life and health expectancies were closer across the UK countries. While life expectancy was greatest in England at almost 18 years, healthy life expectancy was greatest in Wales, close to 11 years. Disability-free life expectancy was highest in England, and Scotland had the lowest life and health expectancies.
Now we'll look at the figures for females across the UK. Life and health expectancies tend to be higher for females than for males, but the gap between these measures also tends to be greater. This means that females tend to spend lower proportions of their lives in very good or good health, or free from a limiting chronic illness or disability. At birth, life and health expectancies for females were greater in England than in any other UK country. Life expectancy was just above 82 years, and healthy and disability-free life expectancy was around 65.5 years. Scotland had the second greatest healthy life expectancy at 63.5 years, while both healthy and disability-free life expectancies were lowest in Northern Ireland.
For females at age 65, England again leads the group for life and healthy life expectancies. Healthy life expectancy was lowest in Wales at around 10 years, compared with a life expectancy of 20 years. Women in Wales could expect to spend just half of their remaining lives in good health. On the other hand, disability-free life expectancy was highest in Wales and lowest in Northern Ireland, where women could expect to spend less than half of their remaining lives free from a limiting chronic illness or disability.
Next, we will look at trends in life expectancy and disability-free life expectancy in the UK as a whole between 2000 and 2002 to 2007 and 2009. Recent trends in healthy life expectancy are not readily available due to changes to the survey question used to define good and not good health.
First, we'll look at how estimates of life expectancy and disability-free life expectancy have changed for males born between 2000 to 2002 and 2007 to 2009. Here you can see that life expectancy, the green line, has increased over time by 2 years from 75.7 to 77.7 years. Disability-free life expectancy, the orange line, has also risen over this period from 60.3 years to 63.4 years, an increase of 3.1 years. Males born between 2007 and 2009 can therefore expect 1.1 years or almost 2% more life spent free from a limiting illness or disability compared to males born between 2000 and 2002. Now looking at females born over the same period, we can see that life expectancy has risen from 80.4 years to 81.9 years, an increase of 1.5 years. At the same time, Disability-free life expectancy has risen from 62.8 years to 65.1 years, an increase of 2.3 years. Females born between 2007 and 2009 therefore can expect 0.8 of a year, 1.4% more life free from a limiting illness or disability compared to females born between 2000 and 2002. From birth then, there is evidence for the compression of morbidity over time. Compared to those born in earlier years, males and females born more recently can expect to spend greater proportions of their longer lives free from a limiting illness or disability.
Now we'll look at men and women aged 65 over the same period. For men aged 65, life expectancy rose by 1.7 years, from 15.9 to 17.6 years. Disability-free life expectancy also rose over the period, from 8.8 to 10.2 years, an increase of 1.4 years. Although the increase in disability-free life expectancy was slightly less than the increase in life expectancy, the actual proportion of life spent free from a limiting illness or disability has increased by almost 3%. For women aged 65, life expectancy rose over the period by 1.2 years, from 19 to 20.2 years. Disability-free life expectancy over this period increased by 1 year, from 10.2 to 11.2 years. This represents a relative increase in the proportion of life that women could expect to live free from a limiting illness or disability of 1.7%. As at birth, for men and women aged 65 in the UK, there is evidence for the compression of morbidity. People seem to be spending longer periods of their longer lives in better health.
To learn more about health expectancies, and for the latest data, please visit our website. The second podcast in this series relating to health expectancies deals with subnational health expectancies across England and what they can tell us about inequalities in health.